Start the timer. Here we go. Okay, so I have talked to you all before on the concept of 3D printing. We're doing it here in the labs and that kind of thing. We're actually focusing today in this presentation on the straight-up biomedical applications and how it is currently affecting your all's industries. Everything from diagnostics to surgery, physical therapy, respiratory, radiology, it's all there. Now, those of you all here have the hard copies of kind of the information that we're going to be showing you in a quick format. Other sites will be having the information, basically sent out for digital. So you may or may not have those. But real quickly, what we're going to do is show you the work that one of our students, our biology students, her name is Heather Beebe. She's actually been working on a special projects course this entire semester focused on the applications of this. She's done a huge amount of work, and it's extremely condensed today. So you're only getting a fraction of kind of what she's accomplished. But just to put it in perspective, she started off with the objective of 3D printing ultrasounds. So that basically 4D, that kind of thing, could have entire fetus printed off for diagnostic purposes, specifically for recognition of imperfections or warning signs. The negative side was finding a company to kind of partner with and actually getting traction with that. And unfortunately, she couldn't do that over the course of the semester, so she transitioned into using the same technology for other type of purposes. Primarily CT scans are what you're seeing. Now for those of you all here, you've got all these samples around your table. So what I encourage you to do is actually pass those around and make sure that you see them all, because majority of them are actually CT scans. In fact, that one right there, sitting in the middle with the neck and spine, that's actually Heather's CT scan. So while she's presenting, you actually will be passing her around, so to speak. And from a diagnostic approach, there's something you may want to pick on. We'll see how good you are at diagnostics. So having said all that, I'd like to introduce Heather, and we'll be kind of going back and forth on a couple items. And if you have a question, throw it up right in the middle instead of just kind of waiting to the end. Okay, so Heather, why don't you start off, and I'll get the PowerPoint. Tell them a little bit about what the first stage of diagnostics was with your skull and spine.
Well, I had been in a car wreck, and they had done some CT scans to be able to see if I had any nerve damage. And the one CT scan on the right is after the wreck, and the other one is the normal neck curve. And those are the kind of images that you usually see for diagnostic purposes on 2D usually. But I was able to use the CT scans with a biology software to be able to make a 2D object based on that CT scan and 3D model it for you to be able to hold it and model it and like twist it around so that you can look at it better than just in 2D images.
Go ahead and elaborate on this going from diagnostics to surgery.
There was a 14-month-old boy at the Cozier Children's Hospital up in Louisville, and he had a heart defect that he had to have life-saving surgery. And they were worried about him being so small and going into surgery, not knowing exactly where it was at. And so what they did was they took his CT scans and they 3D modeled it and printed it off. And she used a flexible material so that she could pretty much perform the operation on the 3D model over and over again to see exactly where she needed to cut, how she needed to do it, so that whenever she went to do surgery, it was more accurate and less risk.
Now, again, how much you want to guess that costs to print and make that?
Less than $5.
Less than $5. You're catching on. Now, just to demonstrate, most of the materials that you see right now are actually hard plastic. The heart was printed in this. It's called Ninja Flex, and it's just a flexible material. So it behaves, synthetic tissue at the very least, but it allows her to do her cuts and exploratory work on a real, I won't say real, but we'll say synthetic similar model. And it was a simulation unlike any other. Now, where was that done?
University of Louisville and the Cozier Children's Hospital up in Louisville.
So basically, one of the things that we're predicting is going to happen is that practice for surgery, you can't get a better simulation. And I don't know if we have the tumor on here or not, but we do. Okay. There's another example of it right here. Cycle it up. What we're basically saying is that surgery prep for this kind of stuff will be really encouraged by malpractice insurance companies, because here's a whole brand new tool that you can do to improve your surgery performance substantially. So we do predict that they're basically going to make it a requirement that you rehearse your surgery on the model of the organ before you go in. Go ahead and tell them about that one.
There was a patient that had a tumor on his kidney, and what they did was they used the CT scans and other imaging to make a 3D model of it with the tumor. And they printed it off and were able to simulate the same surgery onto that model so that they could know exact placing and pretty much do the surgery beforehand before they did the actual operation. And the picture on the top is transparent so they can see the blood vessels positioning inside the kidney so that whenever they go in, they wouldn't be worrying about where it was.
Again, another example of surgery prep. And they actually made the comment this was the best simulation that was possible for them because they got to work on the organ prior to the surgery and rehearse. So that is another application. Obviously, we're looking at educational models here, and I'm going to speed up just a little bit. But Heather also developed the process and also found some other options for educational models. So instead of ordering from a catalog, you can go download these files and print them off, pass them around in class so people can hold for a much more cost-effective manner, hold the models you're looking for. And not only the good ones. Let's say that you actually want to show something that's wrong. You want to do diagnostics and what to look for when it's bad. You can print off versions that are incorrect, or not incorrect, but are actually below average or abnormal, whatever you want to call it, so that they can see what to look for when it's bad. So this is free software. Again, your cost savings is incredible.
Normal knee replacements, the patient usually has to have the second ones done. They don't always work, and they have to be have downtime for a long time after the surgery because they're not custom fit. You pretty much have one or two different types for the whole group. Well, they're now making, using the CT scan and different imaging, they're modeling the knee bone and then making the knee replacements exactly for that person so that they fit better. And there was a woman that had one done, and she had a previous one that she had to get redone because of the problems due to the traditional one. And she said that she was up and walking around just fine after just a few days because it was just so custom made to her body.
In comparison to the time before, what's the difference?
Weeks.
So the old method was weeks, and then the new method was days in terms of physical recovery. Same surgery. Now, another thing is that particular implant was printed in titanium, which these things can do. We don't have one of those in the lab, but it is possible to actually print off in precious metals and that kind of thing too. So you're getting exactly what you need. It's going to be titanium anyway, because the normal implants work. This one is just custom sized. So your implant applications, surgery applications are incredible. Now, where was this one done?
Bluegrass Orthopedics up in Lexington.
Right up the road. This particular one, and I love this, so I want to talk about it. This one actually is a whole new concept. Ultra low density or ultrasound at low frequency healing. The technology has been around for a while, but the application of it's very difficult because it's hard to get your projectors essentially over top of the correct bone point, the breakage point, and hold them there. Normal cast methods obviously don't allow for that. Cast basically is airtight. It's a molded type of material. You don't have flexibility. What this technology is allowing is to take the CT scan, design a whole new type of cast. The cast is custom fitted for their arm. You can see how porous it is, obviously, to allow airflow through. So the smell and the negative side effects of a normal cast won't be there. Most importantly, you see the leads there on the right. The design of the cast can allow you to put basically the nodes directly over top the break and let them be applying low-frequency ultrasound to promote healing. Results so far are like somewhere in the 40% improvement rate in terms of healing. So your physical therapy can greatly shift because of this technology.
Eric, I was just curious before you even asked that. I wonder how much the healthcare professionals will be marking up all this stuff.
That's your all's area. What we're actually trying to do is stop that by taking away the isolated groups that have this technology. So this is our end game. we're wanting SEC to be a flagship. Right now, what are the schools that are using this technology, software you're using?
U of L, Harvard, and some universities in other countries.
This actually software comes from Europe. They gave it to us as a trial basis, and that's all who's using. And there's other forms of it out there, but this is new. It's only in research. What we're saying is, why stop there? Let's train everybody in it. Let's get this out, and let's get it out from here at Somerset. Let's be a flagship. So we're thinking a lot of applications here. One of them you'll see in your packet, the last sheet, is the introduction of DPT 100. This is going to be a computer applications course geared on 3D printing. But that's the starting point, and then, we're thinking this technology needs to be the hands, beyond what we'll teach there. There's opportunities for whole new programs because, the new statistics coming out show the growth in certain areas. Obviously, the medical industry is going to have growth. There's a projected growth associated with research and development, and essentially you could be having students leave Somerset with either maybe an additional degree, additional component, but they would be able to take this to the local doctor's offices. Everybody that handles a break, everyone that handles surgery preparation. I mean, we do really think that over time this will become a commonplace in the medical field, especially in surgery prep. So it's really unlimited.